Squamous cell carcinoma, SCC, is a type of skin cancer that originates from the squamous cells, which are flat and thin cells found on the skin's surface. SCC is the second most common form of skin cancer, following basal cell carcinoma, BCC, and it is known for its potential to become invasive if not treated promptly. In this comprehensive guide, we will explore SCC in detail, covering its definition, standard treatments, seriousness compared to other cancers, prognosis at different stages, promising therapeutics in development, challenges, FDA-approved medications, risk factors, and available resources for those affected by SCC. Definition and characteristics of squamous cell carcinoma. Squamous cell carcinoma arises from the squamous cells of the skin, mucous membranes, and the lining of various organs, including the respiratory and digestive tracts. This type of cancer typically manifests as an abnormal growth or lump on the skin or mucous membranes. SCC is strongly associated with ultraviolet (UV) radiation exposure from the sun or artificial sources like tanning beds. It often develops on sun-exposed areas of the body, such as the face, ears, neck, scalp, chest, backs of hands, and lips. SCC can also occur in other areas of the body, including the genitals and inside the mouth. Standard of care treatments for squamous cell carcinoma. The treatment of SCC primarily depends on its location, size, and stage, as well as the patient's overall health. Standard treatment options for SCC may include surgical excision. This is the most common treatment for localized SCC. The surgeon removes the tumor along with a margin of healthy tissue to ensure complete removal. Mohs surgery. Mohs micrographic surgery is often used for SCC located on the face or areas where tissue preservation is crucial. It involves removing thin layers of tissue one at a time, examining them under a microscope, and repeating the process until no cancer cells remain. Radiation therapy. Radiation therapy may be recommended when surgery is not feasible or when SCC has a high risk of recurrence. Electrodesiccation and curettage, ED&MC. This procedure involves scraping away the cancerous tissue and then using an electric needle to destroy any remaining cancer cells. Topical medications. For some superficial SCCs, topical medications like imiquimod or 5-fluorouracil, 5-FU, may be prescribed. Cryotherapy. This involves freezing the SCC with liquid nitrogen, causing the abnormal cells to die. Photodynamic therapy, PDT. PDT uses a photosensitizing agent and a specific type of light to destroy cancer cells. Seriousness compared to other cancers. Squamous cell carcinoma is generally considered less serious than certain other cancers, such as melanoma or certain types of lung or pancreatic cancer. SCC has a lower propensity to metastasize, spread to distant organs, compared to melanoma, which is known for its high metastatic potential. However, SCC can be locally invasive if left untreated, potentially causing disfigurement and damage to surrounding tissues. While it is not as aggressive as some other cancers, early detection and treatment are essential to prevent complications and ensure a good prognosis. Prognosis for Stage 1, Squamous cell carcinoma. The prognosis for SCC at Stage 1 is generally favorable. In Stage 1, the cancer is confined to the top layer of the skin or the outermost layer of mucous membranes. Surgical removal or other localized treatments often result in complete cure. The 5-year survival rate for Stage 1 SCC is typically high, with many patients achieving long-term remission. Prognosis for Stage 4, Squamous cell carcinoma. Stage 4, SCC indicates that the cancer has spread to nearby lymph nodes or distant organs. The prognosis for Stage 4 SCC is less favorable than for earlier stages because of the greater challenges associated with treating advanced cancer. However, treatment options, including chemotherapy, radiation, and targeted therapies, may still be employed to manage the disease and improve quality of life. The outlook can vary widely depending on the extent of metastasis and the individual's response to treatment. The 5-year survival rate for Stage 1 SCC is above 90%, while for Stage 4, it is between 20 to 50%. Promising therapeutics in development research into new treatments for SCC is ongoing, and several promising approaches are being investigated. Immunotherapies. Immune checkpoint inhibitors, such as pembrolizumab and nivolumab, have shown promise in treating advanced SCC by enhancing the body's immune response against cancer cells. Targeted therapies that specifically inhibit certain molecular pathways involved in SCC growth are being explored in clinical trials. Combination therapies. Researchers are investigating combinations of treatments such as immunotherapy plus chemotherapy or radiation therapy to improve outcomes. Prevention strategies. Efforts to better understand and prevent SCC are ongoing, particularly regarding the role of UV exposure and skin protection. A website to visit for promising clinical trials for SCC is onclive.com. The book, Cancer Self-Defense 101 Quick Tips to Help You Survive, describes many integrative treatments that have had positive effects on SCC. Challenges in managing squamous cell carcinoma. While SCC is generally less aggressive than some other cancers, it presents challenges in terms of early detection, recurrence prevention, and managing advanced cases. Challenges in SCC management include recurrence. SCC can recur even after successful treatment, emphasizing the importance of regular skin checks and ongoing surveillance. Advanced cases. Late-stage or metastatic SCC can be challenging to treat, requiring a multidisciplinary approach. Preventing SCC involves UV protection, lifestyle changes, and early intervention for precancerous lesions. FDA-approved medications for squamous cell carcinoma. As of my last knowledge update in September 2021, the FDA has approved various treatments for SCC, including cemiplimab, an immune checkpoint inhibitor used for advanced cutaneous SCC, 5-fluorouracil, 5-FU, a topical chemotherapy agent used for some superficial SCCs. Imiquimod, a topical immunotherapy medication used for certain superficial SCCs. Risk factors for developing squamous cell carcinoma. Several risk factors increase the likelihood of developing SCC, including UV exposure, prolonged sun exposure, and the use of tanning beds increase the risk. Fair skin. People with fair skin, light eyes, and light hair are more susceptible. Advanced age. SCC is more common in older individuals. Previous skin cancer, a history of SCC or other skin cancers, increases the risk. Immunosuppression, conditions or medications that weaken the immune system. Chronic skin inflammation, conditions like actinic keratosis can progress to SCC. Organizations and resources for squamous cell carcinoma treatment. Several organizations provide support, information, and resources for individuals affected by SCC. Skin Cancer Foundation offers educational resources, information on prevention, and support for individuals with skin cancer. American Academy of Dermatology, AAD, provides information on skin cancer prevention and early detection. Cancer Support Community offers emotional support, educational resources, and community for cancer patients and their families. For more information, please see the book Cancer Self-Defense 101 Quick Tips to Help You Survive.